The only way not to struggle in between the two options in a question is to decode any clinical question. I am Dr. Ashish Srivastava, the medicine faculty for Next Saviors. You see, the clinical feature of three differential diagnoses, that is thyroid storm, panic attack, and pheochromocytoma, are almost the same. Let us find it out how they are different and what is the correct answer for that particular question. If we take an example, a 32-year-old woman is brought to the emergency department at 1 a.m. with sudden onset intense palpitations, severe anxiety, and the feeling is difficult to describe. Her husband reports that she was completely normal the entire day, but suddenly woke up from sleep with complaints of sweating, tremors, and chest tightness. Some of the laboratory findings are given, and after that, the question ends with the note that over the next 45 minutes, her BP decreases to 150 by 90, heart rate to 120, and she starts feeling better. So, what is the most likely diagnosis the patient is suffering from? So obviously in this question you might struggle that all the features are commonly found in all the three conditions, that is thyroid storm, panic disorders, and pheochromocytoma. But if we identify the pattern, the first step in which we have found that very sudden peak along with the high intensity leading to spontaneous resolution within the period of 10 to 60 minutes, it is suggestive of the panic attack, because in case of thyroid storm and pheochromocytoma, there is no rapid rise and no spontaneous fail pattern observed. So this is step one, on the basis of which you have probably identified the answer to be a panic attack disorder. But we further want to strengthen our findings by looking at the laboratory findings. So what is the heart rate? It is 168 per minute, which is obviously high. The BP is 182 by 110 millimeters of Hg, which is again elevated, and temperature is 99.8 degree Fahrenheit, which is not fever. That means it is absolutely normal. Now, thyroid storm must have a high fever, but here there is no presence of high fever, so thyroid storm can be ruled out, because in case of a thyroid storm, the patient usually presents with a temperature of more than 102 degree Fahrenheit. So absence of fever immediately makes the option, that is thyroid storm, unlikely. On the other hand, now pheochromocytoma might be presenting with the paroxysmal hypertension, but let us see what are the other lab findings provided. Here the glucose values are slightly elevated. The troponins level are normal, on the basis of which you can rule out the acute coronary syndromes. Arterial blood gas analysis, it shows respiratory alkalosis, and this respiratory alkalosis, it is because of the hyperventilation, which is classically again is seen in panic attack. So all the findings which we see in this question are pointing towards the panic attack. On the other hand, the recovery pattern is also being observed, that within the period of 45 minutes, the symptoms improves significantly. So this recovery pattern is extremely characteristic of the panic attack, because it tends to resolve quickly even without the pharmacological intervention. On the other hand, the thyroid storms, it never settles spontaneously, and pheochromocytoma episode, it tends to last longer and often leave the patient drained, fatigued, and with the persistent hypertension. Answer for this question is panic attack or the panic disorder. So why is it not the thyroid storm? Because there is no fever, there is no provision of GI alteration. That means there is no presence of the vomiting or diarrhea. Then there is no evidence of hyperthyroidism. Then because it is presenting with the sudden onset and spontaneous resolution, so it does not fit the thyroid storm, and TSH and T3 T4 levels are not provided to you in the question, so thyroid storm can easily be ruled out. Next, why is it not pheochromocytoma? You see, for pheochromocytoma, there has to be a provision of severe pounding headache, which is not provided to you in the question. There has to be a feature of episodic palpitations that lasts longer, and they also tend to recur frequently. But here there is a spontaneous resolution, and these pheochromocytoma, they are presenting with very high glucose level, but here the glucose was found to be mildly elevated. So pheochromocytoma is not primarily triggered by awakening from sleep with fear, but panic attacks are. And acute coronary syndrome is very easily ruled out because troponin levels are normal. Pain is described as chest tightness during the panic. There is no radiation, there is no risk factor, and there are no ECG changes. So these symptoms they resolve quickly, while in acute coronary syndrome they do not resolve spontaneously like this. So answer for this question is panic disorder. So this is how, by ruling the other options out, you have to mark the correct answer. And when you practice these kind of the clinical questions on the day-to-day basis, it comes to your subconscious. The journey will lead you to the correct answer when your subconscious gets trained accordingly. Thank you very much for listening. All the best for your examination. Every day from 6:30 to 8:30 a.m., a fresh clinical paper will be uploaded free of cost on the Next Saviors app. So Saviors, no confusion, no regrets. Just practice, precision, and progress.